today's training, we're working on the infographic in this really the sales cycle where we're focusing on the different care plans in the office. There's really two different visuals you can go off of. We typically do not go here unless we have to. This is where you get into a bronze or a bronze 9-month care plan. Patients starting out in chiropractic care, they have an intensive portion of care that they're going through first, and that is our silver plan. So the silver plan has a start date, and then we have an end date 4 months later with the full reexamination. Checkpoints are every 12 sessions. So if you're watching this video, you're thinking, well, that's 36 visits. You're right. 12, 24, 36 with 4 buffered in at the end to get exercises buttoned up, to get ongoing recommendations buttoned up, and then they would start into corrective care. So every 12 sessions, they are being tested. The goal of the initial intensive care plan is to take a patient through the fastest correction cycle and the fastest stabilization of the spine misalignment. So when they're subluxated, you're going to see a much faster response when the body is getting adjusted 3 times a week and they're going down to 2 days a week. If you think about it and just put a little bit of concept to it, 3 times a week, let's say they were choosing Monday, Wednesday, Friday, you're a day to 2 days between the adjustment, right? So 1 to 2 days are what I tell patients. We're seeing how well you hold the adjustment. And then let's say, okay, when you go down to 2 days a week after your first 12 visits, you pull that day out of the schedule that you don't want to come in or you want to drop. Let's say they drop Wednesday, now they're Monday to Friday. So basically, I tell patients now you're 3 or 4 days apart. The concept is that when the spine is holding and the nervous system is responding and correcting, we should be able to take adjustments a bit further apart. And then the goal when you get to the 4-month mark is to evaluate whether they can get into corrective care, which I'll talk about in a minute. But corrective care is a 7-day apart adjustment. So that's a natural progression. They're not regressing, they're progressing in care, not having to come in as much because they're doing the work and the corrections showing on the testing. So when a patient's coming in the clinic and they're in intensive care, the silver care plan, that is the ideal. That is the fastest correction. It's happening 3 days a week down to 2. And if a patient is in the reexamination and they're into corrective care, naturally going from 2 days a week down to 1 is going to be a pretty simple transition for them. Okay. Now, if a patient cannot do the silver plan because of typically 2 things, financials or distance, right? Those 2 things would lead to a bronze plan emerging. Bronze plan is the same number of visits. We're still 40 visits in. The goal is the same. We're looking to stabilize the spine condition. We're looking to slow down the damage. And really, if you look at the sheet that the Checkout CA gives the converted patient with the little explanations of the different stages of care, it says on there that we're looking to get them to feel good again, feel better. So think about a symptomatic change. You might have sciatica. Within 4 months, we want that sciatica markedly better, right? And so that's the goal of the initial intensive silver care plan. But if somebody cannot do the silver and they can only come in twice a week, then we call that bronze, which is a 6-month review. It's less correction than the 4-month review as far as how much correction we expect to get. Because they're not coming in as often, the spine has the opportunity to want to regress backwards. Muscle memory, their lifestyle, all those things that pull their spine back out. They're not having that chiropractor's hands on them as much. Does that make sense? Okay. And then towards the end of the bronze care plan, they do go into a weekly visit. We're preparing them for corrective care. So it's roughly 10 weeks of once a week visit that they would go down from 2 days a week to 1. The other bronze care plan is a bronze 9-month care plan. It is simply a once a week visit that lands 9 months out. So all of the mapping for the care plans should be the same as far as when the testing occurs. It's just how drawn out is the testing, right? And then of course, when you're watching this video, there's a lot of individualization within care plans. Decompression, some people get it, some don't, lasers, etc. Generally speaking, the mapping is laid out the same. If someone was getting a test on the 12th visit, it'd be a month in if they were on silver. It's a month and a half in if they're on bronze. It's almost 3 months in if they're on bronze 9 months. And when you're watching this video, some patients can only come in a couple times a month. We don't really go down that pathway often, but it would be called a bronze 20 months. And that's a long way out until they get their 12th visit, right? They're going to be getting 2 visits a month, almost 6 months out until they get their first testing. So keep that in mind. That's why when you're talking about the infographic and you have a patient that's looking to discontinue care or maybe change a care plan, these are designed to help you walk the patient through. Okay, Lauren, you want to go from the silver plan to the bronze plan. Just recognize that's fine. It's going to be a little slower process, and recognize that by the time you get to 6 months in, we do not expect as fast a result if we would have had the 4-month mark. So last thing, as you're going from intensive care where you're wanting to feel better, the goal is to get into corrective care, which is the body has stabilized, but now we want to get into where the body is getting more correction, alignment, adjustments are holding longer, and function is improving. We expect someone to be able to have more function in their exercises, which is where the functional exercises come into play in corrective care, than someone who's getting core consultation exercises in their initial intensive. These are core fundamental exercises just to get their spine and their posture to start correcting. But functional, we're putting movement in when the spine is ready for it. Does that make sense? So the infographic should be designed to not just look at, but to explain it to the patient, pause, slow down, make sure they understand it. And then ultimately, we want to get into wellness or maintenance care. On the infographic, it shows maintenance at the 4-month mark here. And the reason it shows that is because if a patient has achieved, like sciatica is gone and they feel really good, even though their x-rays aren't fully corrected, they might have goals that have shifted and they just want to maintain that position of correction that they got up to that point because they feel good, and they may choose to just go maintenance from there. Obviously, what we don't want is for them to stop care or anyone because they're simply going to regress over time and walk back in with the same condition. The goal, though, ideally is to go through silver care, initial intensive, 3 days a week down to 2, 4-month review the data, x-rays side by side, make new recommendations for care, get into corrective care. They're 1 day a week now, 7 days apart. They do that for 8 months and they get into the reexamination. Now we have a year of care overall, and we have a total between 70 and 80 visits, right? Just put that in that ballpark. And now we're looking at how much correction at the year mark from when they first started. And then we're going to talk wellness or maintenance care here. And the goal is to get into wellness care where it's more of a lifestyle change. We call it the top 1% club. You're going to get your best benefit by staying on top of your life stressors, and the conversations from the doctor and team should level up as well. Wellness club, right? We don't call it the maintenance club, wellness club. That's the ideal, right? So you can go from wellness to maintenance even the monthly if you needed to. But of course, those are going to be less desirable because you're going to see the patient not hold an adjustment as long. So as you're watching the video, familiarize yourself with how to talk the chart. If you're a checkout CA, make sure you understand how to show them. If they have to change a care plan that's less desirable, show them these little bench points and show them the illustrations, help them understand that this is a faster arc than this arc right here as well. So that should help you out.